office hours. Thank you. So yeah, again, thank you for joining. I appreciate you taking time out of your day to join us. I think you're going to find this topic really relevant, and we've got some great people presenting as well. So if you can move to the next slide, Stephen. So this topic is going to be LumaPay, one of our brand new product releases, and we've got Gabby Dillon, Customer Success Manager, and Stephen Amon, our Senior Product Manager, taking you through the financial journey this morning. Today's agenda. So Gabby's going to take you the why behind the patient financial background, and then Stephen's going to take you through a demo and the roadmap for the Luma patient financial journey, followed by a question and answer at the end. So if you have got any questions, please feel free to put them in the chat, and we'll do our best to ask them at the end of the call, unless one of the presenters sees a question relevant and they can answer it on the spot. So, but we will get around to all your questions. And yeah, just a quick note, this call will be recorded, and I'm going to hand it over to Gabby.
Great. Thank you, Nathan. If we could go to the next slide, Stephen. Thank you. It's great to be here with everybody. My name is Gabby, like Nathan said. I'm a customer success manager here at Luma. We're really excited to go through LumaPay with you all today. Before we started, though, we wanted to hear from you guys first. Something we're curious on your opinions of this is one question being, what is a benefit of capturing a patient's copay prior to their appointment? If you want to put your answers in this chat so everyone can see, that'd be great. And, we probably are expecting a lot of answers from the clinic side. But if you can think of any patient benefit to getting the copay prior to the appointment as well, feel free to share that. Nothing? No thoughts or ideas here? Okay, I see some trickling in. Yes. Saves time when the patient gets to the clinic. It's streamlined for the patient. No-show rates. Yeah, okay, great. So these are all hinting at, helps added insurance verification. Exactly. It basically, makes it easier on both the patient and the clinic, and really giving both parties kind of like a one-stop shop, essentially. Clinics have the ability to see what all of the copays are going to be, give them to the patient before they come in, so that the patient also can see that information, be prepared, not have any surprises when they see the bill afterwards. This will also encourage them to pay the bill before as well. Sorry, I'm looking at the chat. Yeah, all of these are great ideas. Thank you for sharing that. So this actually is perfect. It really brings me to the next slide, Stephen, of, why this financial experience matters for the patient. We looked at Becker's healthcare report. They surveyed around 2,000 people, and the findings were pretty crazy. 43% of patients said that their behavior changed due to the costs. So this is huge, right? Just due to the cost alone of a healthcare appointment, their whole view on that visit is going to be altered. And from that, we found 53% of those people were stressed about the bill that they're going to receive, getting it in the mail, either after the visit when they don't really have anyone to talk to about where that cost came from. 88% of people wanted to just know the cost up front anyway. So, there is some data showing that people really just want to be told how much their visit is going to cost before they even come in to the office. And, 53% of those patients were in some cases surprised by the amount they owed, right? Because they're getting that after the visit, probably not talking to the office or their provider about, how that is added up. So bottom line here, patients change their behavior based on the financial experience. If we go to the next slide, Stephen. And that's why we want to help patients pay by making it easier for them. We know that people maybe only pay in person, they have to mail things, there's tricky websites that they have to go to pay. All of that really impacts whether or not they're going to complete the bill. So our idea here is giving them, like I said, a one-stop shop, making it really clear where they can pay, how much they owe, and giving the clinic the power to make that really understandable for their patients as well. Some common gripes, that I'm sure you're all aware of with a patient payment experience is, they only pay in person, maybe only know about the bill afterwards. There is limited communication or even an understanding through that bill calculation process, which ties into, transparency beforehand. All of that really resulting in just stress, worry, apprehension, and a more negative patient experience. And we at Luma are really focused on a positive patient experience. So, we're hoping LumaPay is helpful to you guys in that regard. And if you go to the next slide, Stephen. Oh, perfect. There are, 3 insights we want to make sure you guys are taking away from today's call. One being providers want a one-stop shop for payments. Makes it easy on them, also makes it easy on their patients, which helps to make it easy on them as well. Number 2, the patient's financial experience matters. This matters because it will, allow them to complete their payments, allow them to understand how the payment is calculated, the reasoning for it, and gives them a much easier experience to complete that payment. And lastly, like I said, a better payment experience really increases the payments here. I know that is a main goal for all clinics. And all of these things really tie into giving the patient just a better experience when they are going through this type of process. So with that being said, I do want to hand it over to Stephen to go through the actual LumaPay demo. He'll show you, what it looks like from the clinic side as well as the patient side.
Nice. Thank you for that explanation, Gabby. Appreciate it. Let me do a little quick sleight of hand with the screen share now and change this so that it's over here. Awesome. Cool. Hopefully y'all can see my screen here. Nice.
Yep.
So patients, right, have a bad payment experience. You guys want to streamline this into your workflow. Here's a little short demo. We're going to walk through what an average day or practice might look like and start with the schedule view here. You have today's patients coming in, right? And we can click on any random patient, in this case, Nico, and we can go ahead and go over to their financial tab and we can see exactly what their account balance is, what their next appointment is. Basically, we're pulling all of this from their EHR, your EHR, and we're having timestamps for when each of these pieces of information is going to be pulled in. You can see over here on the payments tab, that's showing every single payment the patient has made to you. The insurance verification tab we'll go into in a second, as well as the appointment copays. But basically, this is your way to troubleshoot the patient's finances and to understand exactly everything that's happening in their account, every financial interaction basically they've had with you. But in this case, our main question is, has Nico paid for his chest x-ray, that copay? And we can see that he has, based on this paid badge on the next appointment card. But obviously your question is probably, and you can, see each of these insurance verification, these appointment copays. Your main question is probably like, who hasn't paid though? And if you, sorry, this was not set up well. And if we go back to the schedule view, there's an actual filter here. We can go to the payment status here, simply click on not paid. And then from here, we can basically see, okay, not paid. Here I have 2 patients, one being Bart, makes sense. And if I click on Bart's profile and go to his financial view, I can see he hasn't paid his next appointment. And now you're probably wondering, well, like what's happened at this point? So you've likely at this point set up probably 2 flows. You've probably either had your copay be sent the day before or morning of the appointment so the patient could pay on their phone. And then 2, you might have the account balance sent, depending how fast your office is at calculating that from their visit, maybe 5 to 8 days after. In this case, we need to follow up with Bart about this copay. So we know we've already sent him a message saying, hey, could you pay this? Let's go ahead and send him another one. And you can see all you have to do is open the hub here, click on the appointment copay, select which specific appointment you want, and then go ahead and send that to Bart right there. At which point, Bart will then be able to open it from his side. He will be able to add a credit card, put this in, and he can save this on file for future use, depending on the billing vendor, and then go ahead and pay that. And he can print the receipt here, etc. This is his end screen for that link we just sent him. And then on your side, you now can go straight back to this view as well, and you would see Bart not in there anymore. And likewise, when you go to his financial screen, you can see that this is paid as well. And you can view the details for these payments. You can see the vendor transaction ID, use that to manage the transaction. If you need to void, cancel it. And all of this basically allows you to see for each appointment whether or not he's paid that particular copay. So that's the kind of overall view. And this is, I think, kind of bleeds into the next part of what we have now versus what we'll have in the future. There's kind of a short, medium, and long-term plan, and that kind of bleeds into what workflows you have. So I'll check the chat for questions, and we can always come back to this. But let me head back to the presentation now, and we can continue with this and kind of go into what some of those current capabilities are. Just to recap, we can retrieve the copay or balance from your EHR. And typically what we've seen is the balance lies on the patient level, and then on each appointment, there will be a copay. So we're releasing this per EHR. NextGen and ECW are at the moment what we have. But in the future, we'll be adding all of our platinums very soon. Likewise, we can send these copay balances. We did like a manual flow there. You typically would have these just sending automated, right, the day before, 8 days after for balance. You can put these in the form. You can put these in custom actions, obviously, and templates. And of course, you can manually send them via hub, right? So there's 3 ways you can send the balance and appointments copay, or just, a specific number you need to collect. So some of you might have workflows where you have the office putting in that number into the EHR. If you wanted, you could simply put it into Luma as well with using that custom field. Patients are able to pay. You can place this in your scheduling workflow. And we'll talk about how eligibility, once we have that, will change what that means. This was going to Adrian's question earlier about our Change Healthcare partnership. So we'll speak to that in a minute. And we're also pushing these transactions back to the EHR, obviously. So the standard is end of day batch posting. The billing vendors, depending on which one you choose and depending on the EHR, might have better posting than that, might have real time, but you'll have to talk with them since they handle that. And then likewise, seeing the patient history and all their financial interactions with you and Luma Health in that overview. This is what we have today. What we're working on in the future in the next 6 months are pretty much the following. So we're going to do some polish on LumaPay, obviously, and some of this will be more around like automatic management. We had a patient there that didn't pay. Why couldn't we have that be automatic in terms of send them a message 3 days after their appointment if they haven't? asking them to pay, those kinds of capabilities, as well as bulk patient management. Get me all the patients that haven't paid today, and let's send them a reminder instead of having to go one by one. But the main new capability, a new add-on with insurance verification, this is really just around validating that a patient's insurance is valid. So we'll be able to put this in the schedule view. The patient, once they add their cards and are finished, we'll run that verification real time. The patient will see which cards aren't valid and be asked, is this correct information, or do you want to update, just so it saves you guys a back and forth there. But this allows you basically to ensure that only patients who have valid insurance schedule, if you want to, add that filter. It would be a branch in the form. And then the next one is eligibility, right? So this is getting you that copay, that coinsurance, and all of their benefit information before the appointment. So with this, the new workflow you'd be able to do is you could have that eligibility run at the point of scheduling, see that a patient is eligible, right? And then you have a choice, let them continue if they are, maybe don't if they're not. And then also allow you to collect that copay that we estimate and we get from the eligibility results right then and there at the point of scheduling. So that's kind of the new workflow that enables. Obviously, you get all of these eligibility benefits and results running automatically. You can also, of course, do it manually, but this allows you to basically then automate the copay collection, so you don't have to have staff, putting it in the EHR and us pulling it. And the last one, which is the most far out, is the cost estimation. And this is a little bit past eligibility in terms of more accurately estimating for a more involved visit what that cost might be. And we'll speak at a high level, but basically you'd be able to collect maybe 60% of that, and then the remaining amount at the point of the appointment, or even to give an estimate to the patient if you're interested in that. So that's kind of the next 6 months. This is our general roadmap, right? And we're not, concretely committing to this, but this is how we expect it to go. Could go faster, but generally LumaPay is available now. Insurance verification, the early access is opening up in the next week or so, and eligibility in the next 6 months. So that's kind of the overview, just to give you a sense of when you can expect to change between these workflows. And again, it's a short, medium, and long term, but just wanted to give you that sense as well. Lastly, we got some helpful resources. So there's a ton of help articles our documentation team has been writing for you guys. So I think we'll share these slides after, so you can click on all of these to learn how to set yourself up with LumaPay. And it's a no-cost license, so there's really no reason not to try it out if you want to. You do need to get one of our supported billing vendors, being Instamed or Salutgro, the preferred ones. We also have PayPal, but just note we don't push that back. Those transactions won't push back to your EHR. Yeah, all of these will walk you through how to get started and set up, as well as the helpful implementation checklist. So with that, thank you for listening. I'm sure there's a ton of Q&A, which we can get to now. If people want to post, or yeah, Nathan, I'll hand it off to you for however we typically do this.
Yeah, no, thank you, Stephen, and thank you, Gabby, for the presentation on LumaPay. Obviously, we've got a few questions in the chat right now, and please feel free to place them in the chat and keep them coming. I'm sure Stephen's more than happy to answer all of your questions in the next few minutes. So we've got the first question is, and I think you answered this, Stephen, but can you automate copay squiggly messages with a custom action?
Yeah, so you can make the message whatever you want, right? Just as any custom action can do, and then you can simply put the copay in there to send before or after the appointment. And I think the one caveat you want to make sure is that if you're using the field in your EHR, that you're filling that out before that custom action sends. So if it's a day before, fill it out at least, that day, if not 2 days before the appointment.
Thanks, Stephen. Next question. Do we have the ability to determine in/out of network insurances?
Yes. Ooh, interesting. So that will be with the eligibility result, not with insurance verification, but we will be able to determine and the response, whether they're able to cover you in that insurance type. Yeah, honestly, I need to double check on this. The answer is, I believe, most definitely yes, but I am not concrete on this, so I need to get back to you, Mr. Del Vicio.
Yep, thanks, Stephen. We've got another question. What is the difference in the way Luma is using sorry.
I think we got Michael. Are you just going down the chat?
But yeah, I just got another question. Yeah, sorry. One second. What is the difference in the way Luma is using them between insurance verification and eligibility?
Okay. The difference between insurance verification and eligibility, what's the difference?
Yeah, and how Luma is using them.
Yeah, so verification is really just about, is this insurance valid? So we basically contact the insurance company and they tell us, yeah, like this person has insurance that is active. So it doesn't give you a whole lot, to be honest. The eligibility, on the other hand, that gives you the full response of, yes, for this service type code. So you typically, you'd have an appointment type, and it would be, behavioral, or it'd be a just routine checkup. And we take that service type code and be like, hey, is this patient eligible for this appointment, and what's their copay? We get all of that information back from the insurance company, and then we give it to you. And that's how we know what their copay and their deductible is and all that. So that's the difference. The verification is really just it's good or it's not. And then the eligibility is, all right, it's good, and here's all of the information for this particular appointment.
Thanks, Stephen. Do we have a roadmap for when ECW Cloud will be available?
We do not at the moment. The integration team's taking care of this. So I believe they will be publishing a roadmap on our Platinum EHRs, of which that is one shortly.
Great, thank you. Question from Michael. Can we line item deductible and balance information?
We line item deductible and balance information. At the moment, no. We do not have line item deductible. So Michael, I assume this is basically for their visit, they've had XYZ things during the visit, and then giving them basically a billing statement for their visit. Is that right? Or I don't know if Michael could talk. I will assume yes.
He said yes in the chat. Yeah.
I like this. One audio and then one texting back interaction. So in that case, no, we don't have that in the immediate. We don't have that today. We might in the future. I think the main thing with that is that we have to make sure that the workflow we have for creating that bill of statements is 100% correct. So at the moment, no, we don't have that. And I haven't put that on the roadmap just yet, but I do agree. That is the ultimate, when getting a bill, you're curious what each line item is. Yeah. Solucro actually, I believe, does have that within the iframe. Yeah. One of the billing vendors.
Stephen, question from Christine. Through one of the vendors, is there an option to push back to the EHR?
Yes. So both of the vendors do end of day batch posting to all the EHRs. And then as I was mentioning, that's kind of the baseline. And then above that baseline, it depends on the EHR and the vendor. So some of them have more real-time posting. It just depends.
Thank you. A question from Kelly. Can you only pull the copay from the EHR and not the eligibility check?
Yep. So Kelly, you're hitting it on the spot. So the next step is to, once we have that eligibility check in Luma Health, then you can simply use the copay from there and then have that, payment in the scheduling flow or after, right, or day of the appointment. But yeah, that's pretty much the next step. It's kind of at the moment, we're relying on you guys to define that amount. But then in the future, you can just use our eligibility tool to do that.
Great. We've got a couple of questions from Neil as well. To build on our prior questions regarding out of network and eligibility. So we expect eligibility to provide deductible on insurance specific to in-network providers and out of network providers if the patient had out of network benefits. That was a question. You can see that in the Q&A, Stephen, if you need to read that one.
Ah, there's two different. Okay, I was looking at the chat.
Yeah.
Okay, this is a Neil. I like this. Regarding out of network ineligibility and co-insurance. Yes, deductible and co-insurance specific to. Yes. So I believe we're getting now into the specifics of what the eligibility results are. And we're in development on these. And the caveat I want to give with any answer is that the expectation obviously is that each insurer or payer rather has varied results. And so copay, from what I'm told, and deductible is standard, as well as in or out, but that is not necessarily guaranteed. It's again what the payer gives back to us in the response. So Neil, I think we'll have more information once we actually, give the early access for this. At the moment, I would basically say you can always expect the copay and deductible, but again, it kind of depends on the payer and what they give us. It's not necessarily guaranteed from what I've been told. Yeah.
Thanks, Stephen. Got a message from Christine. What are our next steps to start using this feature?
What are the next steps to start using this feature? I would say to read those articles. We specifically want to build this so that you guys can start using it and have it be easy to use. And so I think the only part we need to come in for is just the integration, making sure that the fields are pulling correctly. But the integration team should be coming out with documentation that basically details where each field pulls from and just making that step the easiest, right? It's always pulling from the EHR, that's the tricky part. But everything else you can set up today and should be pretty easy. Yeah. So those articles, the implementation checklist would be the next step, I would say.
Yeah, and Gabby, sorry, Gabby,
yeah.
Go ahead.
Oh, no. I was going to say, and Christine, I linked the article in the chat for you there. Or if you want our team to set it up, there'll just be an implementation fee. All you need to do is open a ticket for the team.
Gabby, we've got a question from Julie. How do you decide which EHR systems go first?
Our integration team does, and the way they do that is basically looking at which EHRs, basically our platinum first, right? Which ones our customers use the most and would benefit our customers the most. So that's the math.
Thanks, Stephen. Have we got any more questions that we'd like Stephen to answer?
I'll give it get to all these Q&A.
Just got a new one coming in, Stephen. Assuming the charges to patients are pulled from the fee schedule.
The fee schedule. I'm going to admit ignorance of what you mean specifically by the fee schedule. Is that like a thing in your EHRs? Let's see. Oh, okay, the complete listing of fees by Medicare. Yeah, so the charges to patients are pulled from the fee schedule. So this is getting into eligibility and specifically the Medicare flow for this. Again, I think we'll have better answers for you once we have the early access for that. But Medicare is supported, so whatever the standard process is for getting those copays will be that. The fee schedule, yes, of all the procedures, the fees for them, we do have access to that. Yeah, I'm going to be honest, Mr. I don't know, this is Jay Develcio. We're going to have more answers for you once eligibility is early access.
Great. Thanks, Stephen. Give it 30 more seconds. If you've got any more questions. If not, we'll call that a wrap. Okay. Well, I appreciate everyone's time. Again, thank you to Stephen and Gabby for presenting this June's office hours. Keep an eye out for the next one coming through as well. I'm sure we'll have an interesting topic for you as well. So again, thank you everybody for joining, and have a nice rest of your day. Thank you.
Thank you. Bye, guys.